everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Solifenacin. Its brand name is Vesicare. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Solifenacin exerts competitive antagonistic effects on the muscarinic receptors. In terms of indications for use, this medication is indicated to be used in the treatment of bladder muscle dysfunction, typically when it's overactive. Usually this would be accompanied by symptoms of urgency, urinary incontinence, and increased urinary frequency. Now before somebody was to use Solifenacin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Solifenacin or any other component of the product, they would not be able to use this medication. This medication would not be given to patients who have gastric retention or urinary retention. And lastly, it would be contraindicated in patients who have uncontrolled narrow-angled glaucoma. Now in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to elderly patients who have delirium or who are at risk of developing delirium because it may induce or worsen delirium. We would also want to avoid giving this to elderly patients who have dementia or cognitive impairment due to some of the CNS or central nervous system adverse effects that they may experience. We should avoid giving this medication to men who have lower urinary tract symptoms or benign prostatic hyperplasia because decreased urine flow and urinary retention may occur. We should use this medication cautiously in patients with a known history of QT prolongation. We should also use it cautiously in patients who have decreased gastrointestinal motility. A dose adjustment is recommended in patients who have moderate hepatic or liver impairment, and it's not recommended to be given to patients who have severe hepatic or liver impairment. It should be noted that anaphylactic reactions have rarely been reported. Angioedema of the face, lips, tongue, and larynx have been reported. This can happen after the first dose or after multiple doses, and in some rare cases, this can be life-threatening. Anticholinergic central nervous system side effects have been reported, such as hallucinations, confusion, headache, or somnolence. So we should monitor for these during dose increases especially, and when the medication is initiated. This medication should be used cautiously in patients who are being treated for controlled narrow-angle glaucoma. It should be used cautiously in patients who have clinically significant bladder outflow obstruction because of the risk of urinary retention. And lastly, it should be used cautiously in patients who have renal impairment. If a patient has severe renal impairment, so a creatinine clearance less than 30 mL per min, then a dose adjustment would be necessary. And once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Solifenacin, they can expect to receive their dose orally. So if a patient is using this medication to treat bladder muscle dysfunction, they would typically start off with 5 mg taken once daily, with the option to move to 10 mg once daily if 5 mg is not giving them the relief they need. As with all medications, there are some side effects or adverse reactions that patients may experience while using Solifenacin, so I'll go over some of those here now. 5 to 13% of patients may experience constipation, and 10 to 27% may experience dry mouth. Now, some more rare but serious side effects would be a prolonged QT interval, bowel obstruction, confusion, headaches, somnolence, or hallucinations. And finally, we also mentioned the risk of angioedema as well. That's all we're going to talk about today with Solifenacin or Vesicare. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.